Hello, it is Thursday, December 14th, and I was going to be back at the office, but I stole some time to go for a walk around the inlet where I live. This is Port Moody, BC. It is so beautiful today, I could not bear to be inside. So you get me au naturel today. I want to talk about a rectocele. Rectoceles are when your rectum starts to bulge into your vagina. So I'll just give you a quick little demo here. So if you can imagine that the sleeve of my sweater is my vagina, and we have a bladder at the front, we have the uterus on top, and then we have the rectum at the back here. And when the rectum starts to shift out of its ideal alignment, it can bulge into the vagina. And in extreme cases, it would create a bulge that would essentially start to come out of the introitus. So it is uncomfortable and it can be bothersome. Sometimes when it's early stage, people don't even know they have it. But when it does bother you, it can feel like you have something inside your vagina. It might feel like, it just basically feels like you have something in there. And I want to give you some tips today on how you can help manage your prolapse to prevent it from getting worse, how you might be able to improve it. And that's going to cover diet, it's going to cover movement, lifestyle, all sorts of things. So first thing is diet. So if you are eating foods that create gas or that make you feel bloated, or maybe foods that make you constipated, all of those can contribute to an exacerbation of symptoms of your rectocele. So you need to have a balance between insoluble and soluble fiber. You need to make sure that your stool has bulk, but that it is soft. And you also need to eat enough to create a big enough stool, if that makes sense. So there's many people that say that you should be eliminating after every single meal, and that the amount of stool that's there should be, almost the equivalent to your forearm, which is a lot. So I think usually the first bowel movement in the morning is like that, where it could be long, and sometimes you want to have kind of the S shape. If you know of the Bristol stool chart, you want to be kind of around a 3 or a 4. I think 4 is pretty much the ideal, where it's soft formed, so it's not lumpy, it's not hard, it's not like little pebbles, it's one big long worm or snake kind of thing. But you want to be able to have enough in there that it can pass as one big thing, and that part of it won't break off and get stuck in that little pocket that's bulging into the vagina. So that can be a place where stool and gas can get trapped, and that's where you start to get those sensations of feeling like something's in there. So manage your diet, eat foods that are not going to make you gassy or that aren't going to make you constipated, and that will allow your stool to be long and loose and softly formed. When you are having a bowel movement, I've got some rocks here, I'll show you what you should be doing. Get a squatty potty with fine handles, no pun intended, that you can put by your around the base of your toilet. And you want to be able to get your knees higher than your pelvis. Okay, getting dizzy yet? Sorry. Okay, so I'm sitting on, pretend this is a toilet, and I've got my feet up on a rock here, but you can imagine if you had a stool around the base of your toilet that will get your knees elevated higher than your pelvis. That allows the muscle that wraps around the rectum, called the puborectalis muscle, to relax and unkink. So it's got a kink in it to prevent stool from coming out during the day. When we want to eliminate, we want that kink to come out. And when we put our knees higher than our pelvis, it allows that kink to come out. And what you can do as well is kind of lean forward, wrap your arms around your legs, and take a nice big breath in. So when you inhale, your pelvic floor relaxes, and that's what we want to have happen when we are eliminating. And when you have your belly placed against the tops of your legs, there will also be a bit of pressure that's created that can help create that movement downwards. So you wrap your hands around, take a nice breath in, and then you'll ideally feel the, it's kind of like when you give birth, there's a sphincter rule that they talk about where we need some pressure on the floor to be able to signal it to relax and let go. But it shouldn't be something that we force. So you should wait until you feel the urge to go and then get into your position and try your breath and take your inhalation, make sure your belly's pressing against your thighs, and then you'll feel that involuntary response of wanting to almost bear down. However, you don't want to hold your breath. This is similar to birth. You just kind of want to exhale as things are coming out without generating a huge amount of force, without bearing down, and without straining. So that would be ideal from a bowel movement perspective. The other things is movement. So keeping moving through the day, exercise is a great way to ensure that digestion carries on, and that will help move your stools along. So make sure you're getting enough movement through the day. Oh, one more thing about if you're on the toilet. Usually the first bowel movement during the day, if you have enough stool built in there and it's soft and formed and what have you, it usually comes out in one big long snake. But if sometimes maybe you have a second or a third bowel movement through the day, you're going to get into the same position. But sometimes women who have a rectocele, men can have a rectocele too, it just doesn't bulge into a vagina, but you may feel the urge to have to want to kind of tip back, and sometimes that helps. If you feel like it's you've got the urge and you have to go and you've tried your breath but it's just not coming out, sometimes if you lean back it sort of pushes that bulge a little and starts to get things moving. That's not ideal, but sometimes if it means getting it out, that might be what you have to do. And the other thing that you may need to do as well is if you feel like there's stool stuck in there, you may need to actually insert your fingers into your vagina and push that bulge out of the way. So you're essentially, the stool that has gotten trapped in that little bulge, you come in and you push it back in so that it can come back out. You could use a tampon for that if you didn't want to use your fingers. It's not quite as wide. For women that have wands, the pelvic, the Thera wands, that is something that you could insert to push out a vibrator or a dildo or something that's maybe a bit bigger that could go in and push that out of the way. So that might be something that you need to do from a toileting perspective as well. And then in terms of what you can do, pelvic floor physio, blah, blah, I've said that 50,000 million times, you all know that. Go see a pelvic floor physiotherapist, find out what it is that you're dealing with. They can assess it in the vagina, but they can also assess from the rectum as well. You don't always have to have a rectum assessment to be able to determine if you have a rectocele or not. Usually it's better from the vagina because you kind of get to see that where that bulge is at what point in the vagina. So see your pelvic floor physio. Make sure you're doing your core breath or your Kegels every day. And for some, it may mean we want to focus on the back passage more than the front or more than the balance. So cues that have you working your anus more may be beneficial for you. Hypopressives, the hypopressive method is something that I love. The rectoceles, out of the three, so out of a bladder, uterus, and rectum prolapse, rectoceles are the ones that which respond. I'd say the hypopressives are least effective for the rectoceles. However, they certainly are helpful, and they're not going to hurt, and they help with the overall core function. So hypopressive method is something that I use with my clients all the time. It's something that I do myself. And what else can I tell you about that? I think those are the main points that I want to talk about. So tips for living with rectocele. It's not something that is, in advanced stages you may want to have surgery for it. It's one of the easier surgeries of pelvic floor surgeries. But surgeries, there's always risks about it, and it's not always ideal, and there's scar tissue that gets left behind, so it's kind of a last resort. There's so many things you can do to manage it and prevent it from getting worse. So pay attention to your diet, Pay attention to how you hold your body, hold your skeleton. Make sure you're exercising your pelvic floor daily. Make sure you're moving daily. Get a stool, such as a squatty potty or just some small stools at the base of your toilet, and make sure you're seeing your pelvic floor physio. And I see some questions here. I just want to see if there's something that I can... sometimes just holding the TP against the pelvic floor and providing pelvic floor support to the outside. Okay, so thank you, Lori Dula. So she's saying just holding, sometimes having perineal support. So when you're almost like as if you're wiping, holding your toilet paper and pressing against the perineum can help with the stool as well. So great tip. Thank you very much for sharing that. Okay, I'm going to give you one last view. Look at that day. It is spectacular. I am so grateful to live where I live and live by the ocean and the mountains, and I'm going to enjoy this a little bit more. But thanks for watching, and we'll see you next Thursday. Bye.